Welcome to Intellect Medicos, where learning is made easy by Dr. Shruti and Dr. Chirag Madan. If you haven't subscribed the channel, do hit the subscribe button below and also tap on the bell button to get the updates about my new videos. Coronavirus is an emerging public health emergency. Human-to-human transmission has been confirmed, but more information is needed to evaluate the full extent of this mode of transmission. On 12 February 2020, the novel coronavirus was named Severe Acute Respiratory Syndrome Coronavirus 2, that is SARS-CoV-2, while the disease associated with it is now referred as COVID-19. On 11 March 2020, WHO declared COVID-19 as a pandemic disease. In my previous two videos on coronavirus, I have discussed about symptoms, transmission, diagnosis, and also measures to be taken for prevention of COVID-19. Now in this video, I'll discuss about clinical management and the treatment options available. Patients with mild clinical presentation may not initially require hospitalization. However, clinical signs and symptoms may worsen with progression to lower respiratory tract disease in the second week of illness. All patients should be monitored closely. Possible risk factors for progressing to severe illness may include, but are not limited to, older age, underlying medical conditions like lung disease, cancer, heart failure, cerebrovascular disease, renal and liver disease, diabetes, immunocompromised conditions, and pregnancy. Management of severe COVID-19 is not different from management of most viral pneumonia causing respiratory failure. The principal feature of patients with severe disease is the development of ARDS, a syndrome characterized by acute onset of hypoxemic respiratory failure with bilateral infiltrates. Evidence-based treatment guidelines for ARDS should be followed, including conservative fluid strategies for patients without shock following initial resuscitation, empirical early antibiotics for suspected bacterial co-infection until a specific diagnosis is made, lung protective ventilation, prone positioning, and consideration of extracorporeal membrane oxygenation, that is ECMO, for refractory hypoxemia. Patients with severe disease can develop ARDS, sepsis, septic shock, or multi-organ dysfunction requiring mechanical ventilatory support. No specific treatment for COVID-19 is currently available. That is the sad part. Some drugs are under investigation and are being used for the treatment of COVID-19. First is favipiravir, also known as favipiravir, an antiviral that has shown efficacy in treating the novel coronavirus. It is the first anti-novel coronavirus drug that has been approved for marketing by National Medical Product Administration since the outbreak. This drug is expected to play an important role in preventing and treating the pandemic. Second, another drug option is remdesivir. It is an adenosine analog which incorporates into nascent viral RNA chains and results in premature termination. However, the drug is still undergoing clinical trials and has not been yet approved to treat either COVID-19 or Ebola. Third is chloroquine, a widely used anti-malarial and autoimmune disease drug, has recently been reported as a potential broad-spectrum antiviral drug. Chloroquine is known to block virus infection by increasing endosomal pH required for virus or cell fusion, as well as interfering with the glycosylation of cellular receptors of SARS-CoV. Besides its antiviral activity, chloroquine has an immune modulating activity, which may synergistically enhance its antiviral effect in vivo. Chloroquine is a cheap and safe drug that has been used for more than 70 years, and therefore it is a potentially clinically applicable against 2019 coronavirus. Meanwhile, doctors in South Korea have reported that they have used HIV combination drug, that is lopinavir plus ritonavir, marketed as Kaletra, to successfully treat COVID-19. Researchers in China have also asked patients who have fully recovered from COVID-19 to donate their blood plasma for possible use as the basis of new treatment for the virus. This approach, known as hyperimmune globin therapy, has been used for decades for the treatment of viral diseases like diphtheria. Corticosteroids should be avoided because of the potential for prolonging viral replication as observed in MERS-CoV patients, unless indicated for the other reasons. So these are the treatment options available till now, but all are under trial. I'll update you if any further drug or treatment comes for COVID-19. Till then, stay healthy and don't panic. Share this video amongst your near and dear ones so as to spread information and knowledge. Thank you guys for watching this video. Take care.